Hello everyone, welcome to Norris TCM. Today we'll discuss one concept, barrier. The barrier is not a usual concept in TCM textbook. You will never find this word. You will never find the pathogenesis what you learned before. But when you practice in clinic, you'll find a lot of disease, especially in the middle-jiao, or originated from middle-jiao. It's due to such a kind of pathogenic factor, then generate a series of disease. Before we talk about the barrier, let's have a look at the tongue coating in the four pictures. Can you find the differences, or can you find a common point? They are all greasy tongue coating, but different tongue body and different complete signs. Barrier in middle-jiao is a very general concept. It refers to all kinds of pathogenic factors preventing the qi blood material moving in the body. So no matter it's the qi stagnation or blood stagnation, or the water metabolism dysfunction, or it's blood stasis or phlegm stagnation, if it formed a kind of a blockage or obstruction in middle-jiao, I will call this kind of a pathogenic factor barrier. How does the barrier play this function to prevent our body to move normally? First, it will prevent the qi moving. It means the qi in our body is moving up and down, so keep the normal dynamic moving to maintain the normal activities of the body. But we know that the qi in middle-jiao is located in the middle. Spleen stomach locates in the middle. If in the middle-jiao, the barrier formed, it's like a blockage, prevent the qi moving up and down. So generates a series of disease or syndrome by qi stagnation, or make the qi stagnation worse. Second, the barrier in middle-jiao will prevent water metabolism. This means spleen plays its function to distribute the water up and down. We know spleen will transform the water and nutrient to maintain a normal water metabolism. But if there's a barrier located in middle-jiao or formed a blockage, prevent the spleen to scatter the water up and down in a normal water metabolism, it will form the retention of water or dampness. So it will generate a dampness syndrome or phlegm retention or water retention. Third, the barrier in middle-jiao will prevent the distribution of the nutrient. It is also corresponding with the spleen function. If you read the ancient classic book, 黄帝内经 before, there's ancient records about the spleen function. You'll find there's records about the spleen's basic function to scatter the nutrient all around the body. So, spleen plays a function spreading the nutrient to upward or scattered generally. But if there's barrier blocking the middle-jiao, the spleen will lose the function of the scattering and distributing the nutrient. So form the dysfunction of the nutrient. Finally, the barrier in middle-jiao will prevent the communication of heart fire and kidney water. This is not so common, but very common in perimenopausal syndrome. That is disharmony of heart fire and kidney water. This is very abstract concept. What is the loose harmony? That means there is a dynamic balance between the heart yang and the kidney yin. So by this kind of mutual supporting, fire supporting downward, kidney water supporting upward, by this kind of communicating to maintain the yin-yang balance of the body. So we will not feel so hot, we will not feel so cold. But if we lose such a kind of communication, fire moving in the upper jiao, kidney yin or kidney water moving in the lower jiao, so water fire cannot communicate, but forms a kind of a separation. So this is formed very typical perimenopausal syndrome. Not only perimenopausal syndrome, and also some patients suffers the upper part cold feeling and the lower part hot feeling, or its adverse upper part hot feeling and lower part cold feeling. So this is the 4 different functions which formed by barrier. How about the herbs to cope with the barrier? There are 2 commonly used herbs. One is 厚朴, one is 半夏, especially 半夏. 半夏, this herb is a very classic herb, usually used in classic formula in 张仲景 伤寒杂病论 the book. Very typical ancient famous book. One of the most important theory to break the barrier in middle-jiao, that is 泻心汤 theory. 泻 means reduce and break. 泻心汤. 泻心汤 means to break the barrier and break the blockage in this part. So 半夏 is one of the most famous one to break the barrier. It does means if there's a symptom of the dampness or phlegm. Usually when doctors use this herb or when you learn in textbook, it will tell you the herb's function is to resolve the dampness and phlegm and to relieve the stagnation, distension feeling in gastric region. But generally speaking, its function is to break the barrier. No matter it's a phlegm or dampness or qi stagnation or phlegm stagnation or blood stagnation, this is more kinds of like mixture. So it's not very simple qi stagnation or very simple blood stagnation, but it's a mixture of all kinds blocked in the middle-jiao. So we use the 半夏. It's not for especially for phlegm or water. It's to break the barrier, to let the qi water moving freely in the body. Take a look at this case. This is a breast nodule 7 months patient. And in her prescription, doctor used 厚朴 10 grams. And we know the breast nodules is formed by the pathogenesis of the qi and phlegm stagnation. So it's very common. On one side, the qi cannot move freely. On the other side, the dampness, water, phlegm is prevented in middle-jiao. That is by barrier. So barrier is mixture, more like a qi, phlegm, blood stagnation, and forms prevent the qi blood moving, prevent water moving, and there is a blockage formed in the middle-jiao. So that is why in upper or lower, it's very easy to form the qi stagnation because there is no smooth pathway to let the qi water moving freely. So in the upper jiao, the breast suffers the qi phlegm stagnation, form the nodule, that is breast nodule. So in this case, doctor used a 厚朴 to break the barrier to let the qi moving freely. So this is very typical to use the 厚朴 to break the barrier. We know the 厚朴got a very strong function to promote qi moving, break the qi stagnation in middle-jiao, and it is used in asthma patient as well. Asthma, coughing, dyspnea patient will use this herb, but now this patient has no respiratory symptoms. Doctors still use this one, that is to break the barrier in middle-jiao to let the qi move freely. So this is very typical sign for breaking barrier. Okay, now everyone knows what is barrier. So how does the barrier play this function to affect the human body? See you next time. Bye!